We are following a developing story out of Ontario this morning, a tragedy for a Toronto area family. The office of the province's chief coroner says it is investigating the sudden and unexpected death of a child. It comes in the wake of a TikTok post by a nurse that claims a 2-year-old died on the hallway floor at Lakeridge Health Hospital in Ajax on Tuesday. There has been no comment by the hospital, but this morning, Health Minister Sylvia Jones addressed the child's death during a press conference.
I cannot imagine how challenging this must be for the caregivers, the family of that patient. I will let the investigation and the hospital do the work they need to do to communicate with that family. But, I don't think any of us can comprehend how deeply saddened we are when we hear about the death of a young patient in Ontario.
For more, let's go to CTV's Heather Butts, who joins us from Toronto. Heather, what more can you tell us about this story?
Lois, very few details are being released at the moment. In fact, I've reached out to Lakeridge Health several times this morning and have yet to hear back from that particular health department, which oversees the hospital. We do know that the minister there commented this morning and that Ontario's chief coroner's office did release a statement confirming they are investigating the sudden and unexpected death of a child. And now the office says that they investigate when a death is, quote, sudden and unexpected. So the death of a 2-year-old may not merit an investigation if there was a known recorded disease process. So while we don't know the child's background, we don't know the health or circumstances that led up to this tragedy, we do know that it is being classified as sudden and unexpected. For example, if a child had been admitted to hospital for a health reason and then subsequently died, a coroner would not necessarily be called in to investigate, as medical records would show or chronicle the medical care that preceded that death. So certainly a very tragic situation right now that we are following in Ontario.
Yeah, Heather, definitely something that is just so heartbreaking for the family of this child. And this all comes as hospitals in the province continue to struggle with an influx of respiratory patients. Talk to us about the situation right now. What hospitals are dealing with?
Certainly, yeah, there's an influx, Lois, and we've been seeing this for several weeks now. Tragically, we do know that there have been a few deaths in children across the country in recent weeks. Quite alarming for pediatricians because that number is quite a bit higher than it has been in years past, and of course higher in a shortened period of time. We do know that hospitals are dealing with excruciating wait times, and I think that's what's drawing an alarm to the situation. Is there are reports the child died perhaps on the floor, not actually on a stretcher or in a bed, perhaps not even before being admitted. And so that is what hospitals across the country are dealing with right now. And a new report shows that wait times for emergency rooms are quite a bit longer than they have been in previous months. So the wait time for November, for example, was 22.9 hours that someone waited in the emergency room to be admitted. That's the wait time for October. That's up from 21.3 hours in September. So Lois, we've been covering this, you and I, for several months now. We know those wait times are certainly not getting any lower.
Okay, CTV's Heather Butts reporting for us on this. Thanks so much.
Thank you.